Uh, Today I'm going to discuss one very interesting case wherein this patient has been coming to us for last many years with multiple problems. One with breaks, other breaks, crown, implants, inlay veneers. But then we have been telling that there is some problem with the bite, but she has come only for the teeth which require treatment. Ultimately, we told her she realized that something needs to be done. Uh, when we told her that bite is completely in hit and slide and it is tilted on the right side. If you see the teeth, there is a lower tooth seen this much here on the left side and hardly a tooth is seen on the right side. So the bite is tilted on the right side and it is teeth are breaking because there's a hit and slide and collapse. Now we had to treat it. Then so we began. We told her that we need to analyze the bite, how much tilt and how much slide there is there. So we have to see this is there's no hardly tooth seen. So this much discrepancy has to be covered. We covered it. How we did a bite. We told her that we need a bite analysis. So we did a bite analysis to see how much tilt is there or how much deviation or imbalance is there. So multiple teeth were damaged at this stage. You can see this was broken over a period of time. They were gone. There's no canine tip here. Canine tip should have been like this, like this. There was no canine occlusion, occlusion enamel all over here. Here, can you see this? So multiple signs of occlusal wear, and this is on the lower, and this is on the I can show you the upper. Here you can see this enamel enamel gone all over. So teeth were multiple sign of ocular distress. So what we did was bite analysis was done, and then we started the case. We told that multiple crowns have to be changed and multiple fillings to be done, and we'll balance the bite. Ultimately, what we gave her is this. Equally, almost equal. This was started on 7th October. We finished the case in the March. Now patients come after 6 months because one implant was placed, so we had to place the crown of the implant. But some scaling has to be done. She is not maintained so well. We just do scaling and polishing. Now, how we began was this. In 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 the first stage, we we did a bite analysis, and then after bite analysis, we did a one jig trial, one temporary jig trial without modifying the teeth. And to check the occlusion, what we want is this. So we have raised the occlusion and we brought the occlusion, we balanced it. Can you see this? Both side balance. Then after the trial was done, we removed we removed those old crowns and we did one more trial, modifying the teeth, and we did one more trial with one more temporary counter check it. Okay, and this was done here at this stage. Okay, I can show you the upper and lower. Can you see this? So this was done. Open here, second one trial, and then second trial. Okay, and similar for the upper also. Uh, so this was the original bite from inside, and we raised it and did a trial here. Okay, once this is done, was done, then we saw this is quite okay, and then we proceeded further, and we removed all of them, finished the crown cutting. At this stage, all the crown cuttings were done, and then we made another jig trial of of and tested the occlusion. All occlusion points were tested. We wanted those points, heavy points, the contact points to be seen. So we did the marking of these wherever was necessary. We did the marking and equalized the pressure. Once this was done, then this is for the lower and this is for the upper. I'll show you. Okay, this is for the upper. I'll show you here. All pressure points were checked. After this, we went to next stage. we gave one more set of crowns. After this, one more set of crown were given to check the final occlusion setting as occlusion was tested again. On that, some teeth were broken and we removed them and replaced the implants. Okay, and 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 then came the next stage, wherein implants were also the caps were placed on implants. This is you can see the implant was placed here and the crowns placed. Then then occlusion was again tested with on all occlusal parameter dynamics. Then she came after 6 months for the final crown of this. Now we are placing this crown here. Okay, so from here to here, the journey went smoothly. She's comfortable. We have given a deprogrammer so that occlusion is stabilized. And I'll show you in quick review. This is the lay on on top. I'll show if I show you. We begin from here and we went transfer temporaries in quick session. This is the final outcome which we have given to her on the lower, and this is the upper. You can see. I'll show you. Uh, Upper is this. Begin from here. Begin from here, and then temporaries, crown cuttings, jig trial, final crowns, and occlusion established and checked for final. So if you see from top from out to inside, this is the original, and see almost jaw into the lower edges touching the upper palatal area. Now we raise the bite and finish it in this here.